So the first visit, I really like to get to know what people's expectations are. And so typically they'll come to the practice and they'll have a series of questions that they need to fill out. We want to know what brought them in, how long they've had the problem, what are their other health concerns, so we get a sense of who they are. And then when I first meet them, the most important thing for me is to get a sense of what they want to achieve.
I think spending time and getting to know them and having them get to know me has helped a lot. I think it's amazing how quickly we get people up and walking again after hip and knee replacement.
I think having more of a personal relationship with somebody who's taking care of you is better than really kind of just setting up this formal wall that I've seen at other bigger academic centers where, your provider comes in a suit and tie, and I could see from where I grew up, if I walked into that clinic, I'd be relatively uncomfortable with that.
In today's world, we have a lot of tools of education. I think in short visits sometimes, there's a lot of information that comes out of patients. So the more we can provide through digital information and handouts, giving them something to read in between visits, giving a chance to answer their questions. I think that's how a patient has a better understanding of what they're going through. Allowing patients to take the information in multiple ways allows them to eventually make a plan that's right for them.
So I think people should expect that they're going to get somebody that cares, somebody that's going to be able to listen to them, talk to them, look at them in the eye, somebody who's going to kind of cut to the chase with what needs to be done and not beat around the bush. But I think they should understand that I'm trying to do the best I can to make them better and in a fun way.
I love to talk with patients. I enjoy getting to know them. I want them to be a knowledgeable consumer of orthopedics, because ultimately when they're coming to surgery and they have to relinquish control of their bodies and their trust, it just makes it so much easier for them.